Jonathan Van-Tam, thank you so much for talking to Newsround. Should we call you Jonathan or JVT? What do most people call you?
You can call me anything you like, I answer to them all.
You are the Deputy Chief Medical Officer for England, one of the most trusted voices during the pandemic. We've got lots of questions sent in to us. Should we start with the first?
Is there a chance of a new stronger variant?
Well, Aaliyah, all viruses change as they go along. There will be further variants of the coronavirus, that's for sure. Whether they're going to be really stronger variants is much more difficult to tell. I personally think that's quite unlikely, but only time can tell on this.
Will younger children have to have the vaccine?
In the UK, we trust our vaccine decisions to a group of independent scientists. Many of them have spent their whole lives looking at vaccines. That committee is called the JCVI, the Joint Committee on Vaccination and Immunisation. And it's always been the case for decades that the government takes its advice from JCVI, and they are considering all of these things at the moment.
When do you think the restrictions will actually end?
I don't think we can say with absolute certainty when the restrictions will end. I can say that public health people understand that restrictions aren't good for us, but allowing the virus to get completely out of control is not good for us either. We've been rolling out these vaccines for over a year now, and many people have more protection on board than they did have last year.
Why people following COVID rules are so important?
We have to do our very best to follow COVID rules because they're not just there for our own protection, they're there for the protection of others. Me taking this tiny measure to wear a face covering in a public place, for example, it's a tiny thing to do, but if millions of us do it, then it actually changes things for the better. And that's how I frame restrictions. We're kind of all in this together.
When do you think everything will be back to normal?
I wish I could just go like that and it would all be over. But we know that this virus will probably be with humans now forever. But I think over time, this is going to eventually die down and become something more like the seasonal flu, which we learn to live with. What I can say is any return to normal is not going to be like a kind of light switch, flick it down and suddenly we're normal again. It will be gradual and it will take time, and maybe the return to normality will just be so gradual that you kind of barely notice it, but we will get there, that's for sure.